And women of all ages in our audience have questions for you, so let's get right to it. First up is Diana. Hi, Diana.
How are you?
I'm good, thanks. What's your question?
So my question is, I'm 23 years old, and I know that they say to wait till 40 until you have your mammogram, but should I start earlier? Can we start earlier? I'm worrisome, especially after this talk.
So the younger you are, the more sensitive the breast tissue is to radiation. So we typically don't recommend mammography to begin annual screening before age 40 unless there is a significant family history or a genetic risk. So the answer to mammography at this point is no. However, while breast cancer is very uncommon in women in their 20s, it is not unheard of. And in fact, I am treating a 23-year-old patient now. So what I would say to you is be familiar with your breast exam. Everyone's breasts have different areas of lumpy bumpy. Don't ignore things that you feel. If something persists for more than 2 cycles of your menstrual period, see your healthcare provider and ask about a breast ultrasound. Ultrasound uses no radiation. It's solely sound waves. It's a very easy and inexpensive test to do. So if something persists, don't ignore it.
And is there a right time of month to do
Yes,
the
best
self-exam?
time to do your self-exam if you're getting a regular period is the week after your period. That's when your estrogen and progesterone are at their lowest. So the breast tissue is least engorged, least lumpy bumpy at that point.
Okay, thank you, doctor. Thank you, Diana. Up next is Allison, is that right?
Yes.
What's
Hi,
your
Meredith.
Hi.
My question is sometimes when I'm out and I'm on the go and, my hands, I stick my phone down in my bra. And my question is, could that cause or, could cause breast cancer or, is that a bad thing?
So there are a lot of myths around breast cancer, a lot of myths that say this causes or this persists. And so one of the myths is that a cell phone put in the position between the breasts can cause a problem. That is not true. Nor is it true that, let's say, antiperspirant, which doesn't allow you to perspire so it keeps the toxins in, that can cause breast cancer. These are not true.
Okay, good to know. You can put your phone there all you want. There you go. Thank you, honey. Okay, up next is Adrian. Adrian is right here. Get my mic to you,
Hi.
honey. Hi.
Now, I know that getting a mammogram is important, but I've heard that getting too many, especially if you're younger, can be harmful. Should I be worried?
Well, as I said, the younger the breast tissue, so women in their 20s, women in their early 30s, the breast tissue is more sensitive to radiation. So at that point, unless there's a family history or genetic predisposition, we don't recommend screening at that point. Well, while mammography hurts and it is a big squish, it does not spread breast cancer. It does not create breast cancer. And the benefits of screening mammography far outweigh the risks.
Thank you so much for your question. Okay, Dr. Drossman, thank you so much for joining us. We really appreciate it. And we will be right back. Remember, go get a